Alberto mentioned, the low employment rate, low labor force participation rate of youth is a national tragedy, is a major concern. It's a concern in the U.S., but much less so. And the reason why it's less of a concern in the U.S. is that labor force participation fell for young people in the U.S. because school enrollment increased. And in fact, if you look at young women, age 16 to 24, the fraction of that group that's either employed, looking for a job, or enrolled in school has actually increased. And for men, there's a somewhat concerning trend, but much less alarming than in Europe. The group that's received the greatest amount of attention, and I think for good reasons, are prime working age men. This group is men aged 25 to 54. Their labor force participation rate has been declining for quite some time in the U.S. I'll show you some evidence on that. Now, about 11% of men aged 25 to 54 are neither working nor looking for work. This group seems to be in particularly bad health. A very high proportion reports a disability. Almost half take pain medication at a regular daily basis. They report very low levels of life satisfaction. And I think this group is a major social concern. I'll show you some evidence that they may have expressed their anger in the last election. So I think this is a major concern and a loss of human capital for the U.S. economy, but a bigger social problem for our nation. But if you wanted to know why it is that the labor force participation rate stopped rising at the end of the 1990s, the answer has to do with women. Labor force participation for men has been falling for over 70 years. It had been rising for women. We had an iconic character in the U.S., Rosie the Riveter, who went to work during World War II, and Rosie's sisters and children and daughters kept joining the workforce, but that seems to have come to an end. And the cohort of women born around 1960, basically my cohort, and afterwards stopped joining the labor force at an increasing rate, which suggests we're not going to see particularly big gains in labor force participation for women going forward. Interestingly, if you look at their behavior and if you look at their reports about their lives, they seem pretty content, particularly the women who say that they're not working because they're taking care of the house. They seem quite satisfied with their life. They find meaning in their life. Unlike men who are not in the labor force, they look miserable. The women look relatively content, which is another reason why I don't think we're going to see a sudden reversal there. Then lastly, we're going to see these trends continue because the U.S. population is going to continue to age. 10,000 people a day are turning age 65, the traditional retirement age in the U.S. So the U.S. is going to continue to face a drag on labor force participation because of an aging population, because of increased retirements for the next 15 years. So this is going to be a concern for some period of time going forward. So I showed you this picture before. I spent a lot of time looking at this picture, trying to understand why it is that it looks like an upside-down U. And if you look at different groups, you get a better understanding of what's driving the aggregate labor force participation rate in the U.S. The red line shows you labor force participation for men aged 25 and over. That has been declining since we started collecting the data. The green line shows labor force participation for women. That had been growing until the late 1990s. Then it peaked, and it stayed at a relatively high level. And since 2009, labor force participation for women has been declining at about the same rate that it's declining for men. Then if you look at younger workers in blue, age 16 to 24, their labor force participation rates rose in the post-war period, peaked in the 1970s, stayed at about that same level to the 1980s, and has been declining for periods of time or stable for periods of time since then. So let me say a little bit about Italy. This shows you the labor force participation rate of prime age men, age 25 to 54, in the original 22 OECD countries. Italy is in blue, and it's easy to find because it has the lowest level at the end of the graph. The U.S. is the black solid line. The U.S. started, like Italy, in the middle of the pack, in the middle of the OECD. Now they have the two lowest labor force participation rates. But also notice that this trend is global. It has been affecting all advanced nations, Italy and the U.S. to a greater extent, but in basically all of the OECD member states, labor force participation has been declining for men. The next chart shows you women. The U.S. used to have a relatively high labor force participation rate for women within the OECD, and now the U.S. is the second lowest. Italy was always on the low end, and now it is really an outlier. Italy's labor force participation rate for women is 20 percentage points below the rate for men. In fact, you could see this in this next chart where I gather some countries here for 2015, prime age 25 to 54, so retirements are not an issue for this group. And the labor force participation rate for women in Italy at 54.9% is well below other OECD countries, more than 10 percentage points below the U.S. labor force participation rate of women, and more than 20 percentage points below the labor force participation rate of men. So where Italy really stands out is in the extraordinarily low labor force participation rate of women. If you compare France and Italy, men are not too far apart in terms of their labor force participation rate, but the rate for women in Italy is 13 percentage points below that in France. The next country with such a big gap between men and women is Japan, just as a point of comparison. So I'm going to next focus on the U.S., and then I'll say a few words about Italy towards the end of my talk. I mentioned the role of aging before, and economists have a pretty straightforward way of assessing the impact of an aging population. There are lots of ways of doing this type of a calculation, but what I do is I divide the workforce, the population, into 16 different age by sex groups, and I know the number of people in each of those cells. I know that we're moving more towards the older groups, and I could recalculate the labor force participation rate using a fixed labor force participation rate, meaning using the rates for each group in a particular year. So to do this calculation, I use 2016 labor force participation rates, and I say, what would the labor force participation rate have been in 1997 had the rates for each group been what they actually were in 2016? That's an example of how one can do this type of a calculation. So the only difference that you're seeing is changes in the population shares across different groups, and that indicates that 80% of the decline in labor force participation that we've seen in the U.S. is a result of an aging population. Changing the weight that we're putting on the different groups. We're shifting towards groups with the lower labor force participation rates. Now, there are a variety of ways of doing this type of a calculation. You can use the average over the whole period, and they all suggest that the aging of the population over the last 20 years has played a significant role, the most important role in the decline in labor force participation in the U.S. There had been a lot of hope that the decline in labor force was a cyclical result, and that people will come back to the labor force once the unemployment rate drops, once the economy improves. Now, I was always skeptical of that view because historically, movement from out of the labor force back into the labor force did not move very much over the business cycle. And that's what this chart shows you. The blue line shows the probability in any month that someone who is not in the labor force comes back to the labor force. And you can see it's pretty flat, and it doesn't move with recessions. It's not lower during recessions than it is during boom times. And in fact, it's been declining over the last 10 years. And the reason why it's been declining is because more people who are out of the labor force are retired and they're older. So I don't expect to see much of a cyclical recovery, and especially now that we are 8 years past the end of the recession, I'm not expecting to see a cyclical recovery in labor force participation. So let's look at the different groups, because I think what's really driving things are secular trends that have been taking place for a while for different groups. Young workers have seen a decline in labor force participation. This shows you the lines on top are the non-participation rate. So we've gone from 26% of young men not participating in the labor force in 1985 to almost 45% today. But if you look at the green line, I count those who are in school as doing something productive. As a university professor, I'm fond of that interpretation. They're investing in their human capital, which will pay off later on. And you can see the trend in the green line is much less alarming. There has been an increase in the fraction of men who are not in the labor force and not going to school, but it's relatively modest. And for women, the increase in school enrollment has more than offset the decline in their labor force participation, which is the case for young people as a whole, because the trend for women is stronger than the trend for men. So that suggests to me that young people have been responding to the incentives in the economy. In particular, the increase in the benefit of higher education, and more young people are going to school longer. Now, that might be creating a set of other problems, such as student debt, but as far as the skills of the workforce is concerned, this is likely to be a positive development. Let me next turn to prime working age men. This shows you men aged 25 to 54. Their labor force participation rate has been declining since the early 1950s. There's been a slight recovery over the last year and a half, but the general trend is down. And about 11% today of prime working age men are not working and not looking for a job. This trend is particularly strong for those with a high school degree or less. And this chart shows you white men, all white men in blue, and white men with a secondary degree or less in terms of their education. And you can see two things. First of all, the labor force participation rate is lower for those who are less educated. And secondly, the downward trend is stronger for those who are less educated. Now, there's still a downward trend if we look at college graduates among men, white men, but it's a stronger trend for those who have less than a high school degree or high school degree or less. And what I think is important, an important explanation here is that the labor market has turned much weaker for less educated workers in the U.S., particularly less educated men. We've seen their earnings drop while we've seen their employment drop. This is one of the major causes of the tremendous rise in inequality that we've seen in the U.S. I think this is related to automation and technological change, reducing demand for less skilled men, but I think it's related to a number of other factors as well. Globalization has probably played a role, and I think some changes in government policy have made the labor market more challenging for less educated men, and the decline in labor unions has probably also played a role. I added a set of questions to a survey in the U.S. that the Bureau of Labor Statistics conducts called the American Time Use Survey. And it was interesting because I worked together with my colleague Danny Kahneman to add a set of questions, and then I went off to the government, and I came back, and I realized nobody had actually analyzed the data. So here's an opportunity for me to share with you what I found. We added questions about people's health, about how they feel while they spend their time, about pain in their lives, and pain medication. And what's striking, if you compare prime-age workers based on their labor force status, men who are employed, unemployed, or not in the labor force, what we see is the men who are out of the labor force report themselves in fair or poor health. 43% of men aged 25 to 54 who are out of the labor force say that they are in fair or poor health, compared to only 12% of employed men and only 16% of unemployed men. So the men who are out of the labor force look distinctly different. If you look at women, the picture is not quite as bleak. 31% of the women who are out of the labor force say they are in fair or poor health, and only 11% of the employed women. That looks a lot like the men. The women who are out of the labor force really are two groups. A group who are very much like men, who are suffering and in ill health, and then a group who are taking care of their household, seem quite satisfied with their lives, and are not reporting themselves in ill health. I'll come back to that later on, but let me look at the men first. This next table reports on whether men said that they had a disability. And the question about disability was quite specific. Do you have difficulty dressing or bathing? Are you deaf or have severe difficulty hearing? Are you blind or have severe difficulty seeing? And a little over 1/3 of the prime-age men who are not in the labor force said that they had one of these 6 functional disabilities. 20% said they have difficulty walking or climbing stairs. 16% said that they have difficulty concentrating, remembering, or making decisions. So it's not only physical health, it's also mental health that is a challenge for many of these men. And I think this is an underestimate because it only focuses on 6 different conditions. In a survey that I did that I'll talk about shortly, I found a much higher fraction of men who are out of the labor force listed another condition. Some said they were recovering from cancer. Some said that they had a bad back. They didn't think of these conditions, even though they had a severe disability. And almost 20% have multiple disabilities. In the survey that we conducted, I asked about, do you feel pain during various activities during the day? Rate the pain on a scale from 0 to 6. If you look at prime-age men who are out of the labor force, over half the time they reported having pain in their activities. Now, pain was actually surprisingly high for those who were employed as well. 26% of prime-age men who were employed, or 29.6%, said that they had non-zero pain. So you might think that Americans are a bunch of complainers. But what's striking is we also take a great deal of pain medication. 44% of the prime-age men who are not in the labor force said that they took pain medication in the previous day. If you look at white men with less than a college degree, 50% of them said they took pain medication on the previous day. And they reported even higher levels of pain than the group that's out of the labor force as a whole. Now, one could say, well, if they took an aspirin, maybe that's not so bad. In fact, if you went to the session this morning on health, taking an aspirin or drinking a glass of red wine might do the same amount of good for you. So what type of pain medication are they taking? I couldn't tell from this survey. So I conducted a survey of 570 prime-age men who are not in the labor force. I did this in the fall of 2016, so these results are very recent. 47% of these non-working, not unemployed men, out of the labor force men, said they took pain medication on the previous day. Very similar to what we found in the American Time Use Survey. 65% of those who took pain medication said it was prescription pain medication. Now, I didn't ask specifically if it was an opioid, but that's the most likely pain medication that would be prescribed in the U.S. today. I asked them directly, does pain prevent you from working on a full-time job for which you are qualified? 40% of this group said yes. And as I mentioned before, 2/3 of them reported having a disability. 35% of this group were on disability insurance. Disability insurance is a program we have in the U.S. for people who have a severe disability and are unable to work on a job that's available for them. It makes you wonder how the other 65% are getting by, because this group receives very little public support other than disability insurance. One might think, well, perhaps their wife is taking care of them, but a very small percentage of this group is actually married. They're not the most desirable marriage partners. So that's a, I think, fascinating question, which I've never gotten to the bottom of, how they're able to afford the lifestyles that they have. Let me say a little bit about their well-being. We added questions in this survey about experienced well-being, how people feel from moment to moment, how much happiness they have, how much sadness they have, whether what they're doing is meaningful, as well as whether they felt pain during those activities. That's a measure of momentary well-being. We also have a question of overall life evaluation. It's called the Cantrell Ladder. Please imagine a ladder with steps numbered from 0 at the bottom to 10 at the top. The top of the ladder represents the best possible life for you, and the bottom of the ladder represents the worst possible life for you. If the top step is 10 and the bottom step is 0, on which step of the ladder do you feel you personally stand at the present time? There are a lot of numbers here, but I can just summarize for you. Prime age men who are not in the labor force feel pretty miserable. Their emotional well-being is very poor. They're not happy. They're tired, even though they sleep a lot. They report that they're stressed, high level of sadness. I already mentioned pain. And they don't consider what they're doing very meaningful. Unemployed are also dissatisfied with their lives. On a moment-to-moment basis, those who are not in the labor force report lower emotional well-being than the unemployed. In terms of this overall life evaluation, the unemployed are on a lower step of this ladder of life than are those who are not in the labor force. One other point I wanted to mention, if you look at this group of men who are out of the labor force, they spend an enormous amount of time alone. 30% of their awake time is spent alone. That's about double what you find for employed men or employed women. And research has found that when people spend more time alone, they tend to suffer more anxiety. So I think this paints a picture of a group that is isolated and fairly disgruntled. Let me turn next to women. I mentioned earlier that if we look at cohorts of women, we see some very interesting patterns. This chart shows you, for women born in different birth years, their labor force participation rate over the life cycle, over the course of their lifetime from age 21 up to age 75. Now, for women who were born recently, we can't follow them up to age 75, so we follow them for as long as we can. And if you look at the cohort of women who were born in 1941, or the way I do this, plus or minus 3 years, so around 1941, you see that labor force participation was relatively low in their 20s and 30s, and then rose, peaked in their 40s, and then started to decline in their 50s. This hump-shaped pattern. If you look at the cohort of women who were born in the early 1950s, labor force participation was considerably higher for them in their 20s and their 30s during the prime child-rearing ages. And that's where we've seen the biggest change in the U.S. It's become much more acceptable, much more common for women with children to join the labor force, to be working or looking for work. That trend continued for the group of women born in the early 1960s. And then it basically came to an end If you look at women born around 1981, 1971, we don't see much difference compared to women born in 1961. And if you follow out the profile for the group born in 1961, they're pretty much mirroring those who were born in the early 1950s. As they reach age 40, age 50, they seem to be following the same path in terms of labor force participation. So what does this mean? Well, historically, the U.S. saw a rising labor force because an increasing number of women joined the labor force. They stayed in the labor force. As older women with a lower labor force participation rate retired, they were replaced by cohorts with a higher labor force participation rate. But that process has come to an end. And I think it's unlikely to reverse. The reason why I say I think it's unlikely to reverse is the group of women who are out of the labor force don't seem particularly discontent with their lives compared to men. That's what this next table shows you. If you look at prime working age women who are not in the labor force, their average on the Cantrell Ladder was 7 versus 7.2 for employed women. They're basically reporting themselves on the same step of the ladder, whereas unemployed women are a full step below. If you look at how happy they are, they're actually reporting a higher level of happiness with their daily activities than are employed women. They're reporting a lot of meaning in their life. Now, I mentioned before they're a mixed group, and you can see that here. If you split out the women whose main activity is keeping house, which is about half of the women who are out of the labor force, and compare them to the rest of the women who are out of the labor force, the women who are keeping house are quite satisfied with their life. They report themselves on a higher step of this ladder of life than do employed women. Moment to moment, they're quite happy. They see a lot of meaning in their life. And the women who are not keeping house, who are out of the labor force, look a lot like men. They look a lot like prime-age men in terms of their emotional well-being, in terms of their low level of life satisfaction. And they also look like men in terms of taking pain medication. Half of the women who are not in the labor force and not taking care of their house as their primary activity say they took pain medication on the previous day. And they're reporting high incidence of pain in their daily routines. Now, I think what we're seeing in these data is symptomatic of a broader trend in the U.S. And my colleagues Ann Case and Angus Deaton have used the term deaths of despair to describe the rising fatalities that we're seeing due particularly to abuse of opioid medication, pain medications. This is particularly an issue for the white working class, particularly for middle-aged individuals. And that's the same type of pattern that we see in the labor force data. So now I want to move to some more speculative results and then end on a high note for Italy. So I mentioned the opioid crisis in the U.S. This chart, which is now a little bit out of date, shows you in red the number of Americans who are dying from overdose of opioid pain medication every year. And it's out of date because even though it has risen from 5,000 to 15,000 from 1999 to 2013, the latest numbers that I read yesterday for 2015 were that 25,000 Americans in 2015 died from opioid overdose. To put that number in context, that's more people than are killed in homicides in the U.S., more people than are murdered, and we have an extraordinarily unacceptably high murder rate. It's almost as many Americans who are as are being killed in car accidents in any given year. And you can also see there's been some rise in overdose of heroin, but overshadowed by the rise in overdose from opioid medication. And some of the numbers are extraordinary. I wanted to mention a few other statistics. Enough opioid pain medication is prescribed in the U.S. every year to keep every American man, woman, and child medicated around the clock for an entire month. In some states, the rate is higher than that, significantly higher. In Ohio, it's more than twice that. The state of Ohio has just initiated a lawsuit against the pharmaceutical companies that produce opioid pain medication, arguing that they intentionally tried to get the population addicted to overuse this medication. The addiction rates are extraordinary. 26% of those who use opioid pain medication become dependent on it. Now, I should say that's of non-cancer patients. But 26% of the I don't know the number for cancer patients. It was only reported for non-cancer patients. 26% became addicted. 1 in 550 people who start on opioid pain medication die from a related overdose. The median period of time from the beginning to death was 2.5 years in this study. And another important observation is that half of those who are on disability insurance and of working age have opioid pain medication prescribed to them over the course of a year. So this is a severe epidemic in the U.S. And I'm certainly not the first to draw attention to this. There were some very interesting observations over the course of the election, and I'll just conclude by sharing this with you and commenting on the fortunate situation in Italy for avoiding this problem. Jeff Guo, who's a journalist, he's now with Vox, he used to write for the Washington Post, did some pretty interesting analysis where he looked at the relationship between the annual death rate for non-Hispanic whites age 40 to 64 and Donald Trump's performance in the primary Super Tuesday, where he did to many remarkably well. And you could see in states like Virginia or Tennessee, in the counties where there's a high death rate, his performance was particularly strong, also in Georgia and Arkansas, Alabama. This next chart is from a paper by Shannon Monat, who might even be here. She's speaking at 7:30. Oh, perfect. I thought I would advertise for you. She's speaking at 7:30 here in Trento. This looks at states in the Midwest and relates how Donald Trump did relative to Mitt Romney. So these are basically voters who switched from voting for Barack Obama to voting for Donald Trump, and relates that to the age-adjusted mortality rate, specifically looking at mortality from drug, alcohol, and suicide. If I had more time, I would have looked more at labor force participation in these states and this same variable. But there's a lot pointing to despair in areas of the country and low labor force participation and support for what I would call a non-mainstream candidate. So let me conclude by noting that Italy has avoided this problem. This looks at people age 50 to 54, but if you look at other ages, you see the same pattern. And specifically, it's looking at deaths per 100,000 people due to drugs, alcohol, or suicide, or suicides. And you could see the U.S. used to have a very low rate in the late 80s, early 90s. And now we have a rate which is more than double what it had been, triple what it had been. If you look at Italy, the rate has declined in Italy. Italy is shown here in green and is the lowest compared to U.S., France, Germany, Sweden, and the U.K. And the U.S. is somewhat unique. There's been something of a rise in the U.K., but nothing like what the U.S. has experienced. So let me just conclude by saying I think the physical, mental, and emotional health conditions of the group that's not in the labor force are a severe barrier to work. I think this is particularly an issue for prime-age men, but also for an important subset of prime-age women. we don't know the direction of causality, meaning I don't know if pain and disabilities cause people to drop out of the labor force, or if they dropped out of the labor force, found access to pain medication, and that's what's causing this correlation that we observe. That's a topic that I'm currently working on. But regardless of the direction of causality, I think it's an important barrier when it comes to employment. I think stronger macroeconomic conditions are unlikely to turn our labor force participation challenge around. I think stronger macroeconomic conditions would certainly help. I think there are many benefits of a high-pressure labor market, but I don't think a rebound in labor force participation is one of those benefits. I think we need to focus on the particular problems that are afflicting those who are out of the labor force. Opioid addiction is a major social and economic problem. I think this suggests we need to focus on other types of interventions for people who have pain, such as physical therapy, also mental health services. Also, I think it's important to avoid the problem in the first place. That's one of the reasons why having universal health care in the U.S. now, after the Affordable Care Act, I think offers us potential to have more preventative care. So why don't I end on that note, and I'm happy to take questions.
Thank you. Grazie, Professor Krueger. Grazie molte. Beh, abbiamo visto che cosa ci accomuna in questa...
Well, we have seen the similarities between the countries in this large share of people who do not participate in the labor force. And we see that there is some hope for Italy. We have that green line, which perhaps is the mirror of our way of life, which is perhaps a medicine in itself. Now, before opening the presentation to the audience, I would like to make a question. I'm wondering, in the U.S., if this intention expressed by Trump to go back on the Obamacare may have an impact on the subject. So what are the mid to long-term consequences of the expected reform of the Obamacare by Trump?
I think that's definitely a concern in the U.S. I think we've benefited so far by the fact that the administration is incompetent and has been unable to figure out a path to repeal Obamacare. I think one of the few issues during the campaign where Donald Trump was actually correct was in highlighting the opioid crisis. And he has made that one of his many priorities. He hasn't, I think, laid out an agenda to address that. But it's possible that as he continues to struggle with the Congress to have health care reform, that he'll actually turn to try to address the problems as opposed to just repeal what President Obama achieved. And I think he'll discover that the Affordable Care Act can be a very useful tool in terms of addressing the opioid crisis. Just today I read that Senator Richard Burr, whose name is in the press quite a bit because he is leading the Intelligence Committee in the Senate, announced that he didn't think that the Senate would be able to achieve health care reform this year. Now, I worry that the administration's hostility to expanding health insurance, providing health insurance and preventative health care services, might cause it to do a incompetent job in terms of administering the law. But even there, I think the amount of damage that they could cause is somewhat limited, because over half of the expansion of health insurance coverage in the U.S. occurred because of Medicaid, which the states administer, and they can make some changes, but they I don't think can blow up the system. For the health insurance exchanges, I think that actually requires some skill and a commitment to the program to attract health insurance companies to want to offer plans in the health exchanges. And so far, they seem to be doing everything they can to make the health insurance exchanges fail. They wanted to stop providing subsidies to health insurance companies for participating in the exchanges. They've reduced the period for advertising when people could sign up. They wanted to cut spending on advertising, and they wanted to cut the enrollment period. So they seem to be trying to reduce the number of Americans who are taking advantage of the health insurance that became available from the Affordable Care Act. But as long as the program is there, I think what we've seen, in the U.S., we've seen remarkable decline in the number of people who lack health insurance. 22 million additional people came under health insurance coverage because of the Affordable Care Act. So as long as the program, I think, is still there after the administration is no longer there, I think it provides an opportunity for more preventative care.
Grazie professore. Ora apriamo lo spazio per le domande. Ne raccogliamo 2 o 3 alla volta, direi, così è più semplice.
Hi, Alan. Hi. If wages had not have fallen so much in the United States, would the participation rate be the same? Or another way, if wages rose by, let's say, 10%, how much would labor force participation increase?
That's a very good question. I think it's more relevant for men than for women, because wages for women have not fallen. Wages for men have fallen, particularly for less educated men. And I think that's probably a big part of the story, but not the whole story. And the reason why I say that is we saw labor force participation falling for men in the 1960s and in the 1970s, before we saw wages stagnate and the real wages stagnate and decline for men. I also think there's an asymmetry, and I say this with a little bit of trepidation with Olivier Blanchard in the audience, but I think there is some hysteresis in that once people leave the labor force, they seem to adapt their lives so they're less responsive to wages for coming back, particularly if they go on disability insurance. Very few people leave disability insurance back for work. But I think that's also the case for others who retire early, who decide they're going to take care of home responsibilities. So the problem that we face, I think, is easier to avoid than it is to rectify. And how do you avoid it? Well, one could have more active labor market policies, particularly during a recession. One of the benefits of extended unemployment benefits is that people remain in the labor force. I would like to see us be more active in terms of helping those who are out of the labor force be more engaged, volunteer. I think we could arrange for the unemployed to volunteer, which I think will help them to find jobs, help them keep their skills, feel better about themselves. And obviously macroeconomic policy, macroeconomic management, countercyclical policy has an added benefit if you have this type of an asymmetry when it comes to labor force participation.
Grazie, buonasera.
Thank you. Good evening. Thank you so much for your presentation. Well, if we don't win with the GDP, we win with the gross happiness index. Well, I'd like to understand if you also compared the American system and the European system and the Italian system in terms of social benefits and welfare benefits, that is, benefits which are given to unemployed people, both as wage benefits or active policies in order to help these people find a new job. Thank you.
I think there are two parts to your question. One has to do with thinking about gross national happiness as opposed to gross national product, or thinking about the quality of life, which I fully agree with. GDP is one indicator of many that we should think about in thinking about the way we want our societies to work. And I think despite the economic problems that Italy faces, and to some extent the Eurozone compared to the US, the quality of life is still remarkably high. And I was engaged for a long period of time with the Sarkozy Commission and probably half a dozen other ones to try to develop better measures of well-being. As far as the unemployed go, there's a trade-off between providing benefits and reducing work incentives, which has been pretty well documented. I think that trade-off varies over the course of the business cycle, which is an argument in favor of extending benefits in the middle of a recession, having them last for a longer period of time. In some countries, I think training for the long-term unemployed is a very helpful strategy for bringing them back to work. One thing I have been advocating in the U.S. for some time, particularly for older workers, is wage insurance, where if a worker lost a job that paid, say, $20 an hour, and the new job only pays $10 an hour, the government would make up half the difference from unemployment benefits as an incentive to bring people back to work. I think that particularly makes sense for older workers who are less likely to get additional training. We have wage loss insurance as part of trade adjustment assistance. The evaluation suggests it's worked rather well there. I think it's on much too small of a scale in the U.S.
Chi tocca?
Your data seems to be about white Americans. Is there anything, a different picture for those who are not white?
I didn't hear, did you?
No.
I'm sorry, can you speak louder?
Yeah.
I still couldn't hear it, though.
Your data seems to be about white Americans. Is the picture any different for other groups?
Oh, yes. So it is different. It's not better for other groups. If you look at African Americans or Hispanics, labor force participation rate is lower, and the trends are similar. One of the reasons why I showed separate results for whites with less than a high school degree is that's a particularly large group, and that's a group where there was a big swing in terms of the last election, and it's also a group that's been particularly affected by the opioid crisis. But I certainly do not want to minimize the employment problems facing African Americans in the U.S., particularly African American youth. And I should have highlighted this before. Another concern in the U.S. is that the high crime rate that we've had and the high incarceration rate in particularly means that we now have a high share of particularly men who have a criminal record, which makes it much more difficult to find employment. That is a problem, especially in the African American community. It's not a new problem. I don't think it's what's causing the overall trends that we're seeing, but I think that is a major social concern in the U.S.
Professore, lei ha mostrato.
You showed a diagram showing the women labor force participation rate, referred to 5 cohorts of women. And the diagram shows that at a certain point in time in their lives, this participation rate falls. And the 5 lines do not move at the same time. Do not move at the same time because if I understood it correctly, we have age on the horizontal axis. But nevertheless, we see the reversal of the trend or the reversal of the curves that takes place more or less at the same age. So I don't know whether you explained it, why. Maybe I missed it. I would like you to elaborate a little bit on this.
This is the chart that you referred to. And to me, what it shows is sort of 2 important patterns. One, if you look at the 1941 birth cohort, 1951 birth cohort, 1961 birth cohort, basically at all ages, you have a higher participation rate for the more recent birth cohorts. And that's especially true at the child-rearing ages. That's pattern number 1. Pattern number 2 is after 1961, it doesn't look like much has changed. It looks like we're seeing the same pattern for the 61 cohort, 71, and 81. And in fact, if you look at it long enough, the 81 birth cohort's a little bit below the 1971 birth cohort. So it's easy to explain the increase in labor force participation of women. It had to do with a decline in discrimination in American society. Professional schools became open to women. I once actually prepared a table for Hillary Clinton in 1995 where she asked me what fraction of law students were women when she went to law school and today. When she went to law school, it was maybe 10% of students, and today it's over half. If you look at a lot of other fields, it looks similar. And it also has to do with economic changes in terms of wages that women earn, societal changes in terms of marriage rates, single-parent rearing, and so on. It's a puzzle why this has come to an end. I think that there was a little bit of overshooting in the sense that for a group of women, even if their first choice was not necessarily to throw their lives into their career, they got a lot of satisfaction from being the very first woman to achieve something. First woman to be a university president, or first woman in their family to be a manager. For the next generation, I think maybe they focused a little bit more on quality of life, and maybe that's why we saw a little bit of backtracking. The hump-shaped pattern, which you asked about, if you looked at men, you would find something similar. And if you look at earnings, it looks somewhat similar. So one interpretation is that this is a life cycle pattern that's mirroring earnings, and the fact that people invest in human capital, they get a return to that, they invest, they get more of a return, and then that peaks, and then it starts to come down, and I think that's probably a factor. I mentioned Olivier Blanchard, who's president of the American Economic Association. Another president of the American Economic Association, Orly Ashenfelter, has done work on life cycle labor supply. So again, I'm nervous about discussing this in front of him. But there are other, kind of obvious explanations for why labor force participation would start to decline at older ages. People experience worse health. They may also reach a point of their lives where they are financially capable of retiring. If you look at the pattern for men, it looks similar, although it rises for a bit longer. But there's nothing interesting going on in the cohort pattern for men. For women, there's something really remarkable going on in the cohort pattern, which is why I showed it for men, for women and not men.
I have a question with respect to the relationship between labor force, non-labor force, and immigration. Would your data allow to deduct that if the low-skilled immigration diminished dramatically, a lot of the people in the non-labor force would be sucked into the labor force?
That's a great question. I think the answer to that is probably no. And I think it's almost certainly no if you think about labor force as a whole. Immigrants have a higher labor force participation rate than non-immigrants. The less skilled immigrants are doing jobs that natives most likely would not be willing to take. So I think when it comes to labor force participation, it's pretty unambiguous that we will have a higher labor force participation rate and certainly more labor force participants if we had more open immigration policy. One of the real regrets I had when I worked for President Obama was that the Congress did not pass immigration reform. The Senate passed an immigration bill, but the House never took it up. And I'll tell a somewhat long-winded story about it because it tells you, I think, where we are in American politics today. It was a very high priority for the president. It was actually a high priority for John Boehner, who was the Speaker of the House of Representatives. He wanted the House to pass a bill. The very difficult issue has to do with a path to citizenship and what do you do with the undocumented immigrants who are already present. Most Americans think it's a good idea to bring the immigrants in the U.S. out of the shadows. They see them in their neighborhoods. They think it would make sense if they could work above ground as opposed to below ground and pay taxes. Those arguments actually were, I was trained in how to talk to the media. Apologies. And what I was told is those arguments work, and I think they're pretty good arguments. For the Republicans, they couldn't bring themselves to have a path to citizenship, even though it would take 11 years for someone who was undocumented to be able to obtain citizenship in the best of circumstances under the Senate bill. There were aspects of the Senate bill that I think made very little sense, like it greatly increased the number of border security guards who don't achieve very much. And President Obama was willing to go along with that in exchange for a more sane immigration policy. The Senate bill that passed was led by Marco Rubio and Chuck Schumer. I think it was a real disadvantage for Rubio for having been engaged in that effort and having led that effort when he ran for president in the Republican primary. And I think the problems that the Republicans are having now passing legislation are very similar to what prevented them from passing the immigration bill. And they were unwilling to bring it to a vote because they knew it would pass with Democratic support. So unfortunately, we're tied up in knots. This is not a problem that Italy is unfamiliar with, but we're tied up in knots because the political system is not working very well. But very briefly on the economics of the bill, the Congressional Budget Office, which is responsible for analyzing legislation, wrote a report which was remarkably favorable. I wrote a report as well, and I tried to be faithful to the research, but I also tried to be supportive. The Congressional Budget Office was way beyond me. They concluded it would raise productivity growth if the Senate immigration bill was enacted. It would eventually raise wages. It would raise labor force participation considerably. So I think we're going in the opposite direction with the Trump administration favoring a policy of building a wall. We're already seeing declines in the number of foreign students who are applying to school in the U.S. So I think that's going to be a further challenge for our labor force participation going forward.
Grazie. Direi possiamo, se c'è l'ultima domanda.
So we have time for one last question.
Seeing these big increases in opioid addiction, etc., in the U.S. and not in Europe?
That's a very good question. And I was speculating before about the political ramifications of these trends. I'm really going to speculate here. I suspect it has very much to do with the difference in our healthcare systems. And I'll tell you a story. I went to see my doctor, and he said, "How are you doing?" As soon as I walked into his office, and I said, "I've got a little bit of tennis elbow. My arm isn't hurting." And he wrote me a prescription right away. And then he asked me, "What are you working on?" And I told him about this study in the opioid use, and he said, "I'm always very careful before I prescribe medication." So I think that there's a tendency in the U.S. in the medical profession to try to prescribe something to make patients go away, make problems go away. I don't think there was enough appreciation of how addictive Oxycontin and other opioid medication were. On Medicare, prescriptions are free. So from the patient's perspective, it's free. So I think the medical profession is now recognizing that this is a serious problem. It's easier in Europe to ration medication than it is in the U.S. Now, we're starting to do that with opioid pain medication in the U.S. About a half dozen states, including Massachusetts, limit patients to getting only 7 pills at a time, so that they will have to go see another medical profession to have it refilled. There are now reviews for the doctors who are over-prescribing it, but that's easier to do in a centralized healthcare system than it is in a decentralized one like the U.S. That's my guess is the main reason. I think when I first looked at the results that I'm finding, my reaction was, this is so hard to believe. Work has gotten to be much easier. The work injury rate has gone way down in the U.S. and elsewhere. The number of work fatalities has gone way down. Why are such a high fraction of workers reporting that they have pain when work looks like it's physically less demanding? So I suspect that work is physically less demanding, and we probably do have fewer backaches than we had before, or at least not more, but the medical profession is prescribing more medication, which is creating more problems than in the past.
Bene, direi che abbiamo esaurito il nostro tempo.
All right, then, our time is over. Thank you very much, Professor KRUEGER, because your presentation was definitely exhaustive, full of data, rich in data, I must say, very, very interesting. And again, I would like to highlight the importance of the, let's say, snapshots that we were provided with on the Italian and the US system that highlight major problems that are still open issues. And unfortunately, on some national agendas, these issues are not even a priority, and this should be a source of concern for us. But I wouldn't like to end on this sad note. We have so many bad news every single day in Italy, despite the good data that were disclosed the other day on our GDP. I would like to candidate once again for a future conference on the rock economics, and at that point the atmosphere will be completely different. Thank you very much.